Hi, this particular video, what we're going to be doing is demonstrating how to administer medications in the laboratory. And it's important that you follow all these steps because at the end of the semester you may have a skills exam that you need to be successful at doing. And also safety is a big mission for our nursing program, so we want you to be safe and to even administer medications this way in the clinical setting. So remember the rights of med administration: the right route, the right time, the right patient, the right dose, the right med, the right assessment. All of these things need to be done. Remember that meds have different timings. Some are before meals, like thyroid meds. Some are with food, like corticosteroids. And then timing is very important with cardiac medications. They're evenly spaced every 8 hours. And also, timing is very important for IV antibiotics, as an example. Remember that a stat med needs to be given immediately and as soon as possible within the hour. Also remember safety in regards to high alert meds. High alert meds have an increased risk of adverse effects for the patient, especially if given in erroneous amounts. Also, in particular, never take a medication with grapefruit juice. Just as a packed rule, it's easier than remembering which meds interact with grapefruit juice, but grapefruit juice has the tendency to potentiate the effect of most meds. Okay. There are different routes to give medication orally. 80% of the meds that we give orally are 80% are oral. Sublingual, a sublingual medication like nitroglycerin goes underneath the tongue, and it should not be mixed with water. It should not be swallowed, and you'll learn more about that. There are topical meds that are placed on the skin, and they're either pastes or ointments, but one in particular that we give a lot are transdermal patches. Transdermal patches usually have more of a sustained release, like nitrates, like opiates, and also hormones. Also, we also give meds via inhalation. There's a nice vascular bed in the respiratory tract. It's really administered and absorbed very quickly that way. So we have inhalers that we give patients, corticosteroid inhalers where they have to rinse their mouth, and then rescue inhalers that open the airways. The other thing that we do is we have ear drops that we give in the ear, whether it's for an antibiotic or for wax. And the same rule applies as with the temperature. To straighten out the auditory canal, for the adult, you're going to pull up and back, under the age of 3, down. Eye drops. Eye drops should be placed in the conjunctiva of the eye. Eye drops should remain pretty much within the eye area. So in order to administer eye drops appropriately, the container must never touch the conjunctiva. And after you administer a drop, it's important that you have the patient or yourself put pressure on the lacrimal duct so that it stays where it needs to have its effect and not go down the nasolacrimal duct. Also, we give rectal meds. Rectal meds are given like anti-nauseants if the patient's vomiting, or acetaminophen for temperature. Again, they're going to lay on their left side, left sims. It goes into the rectum, the suppository, after being lubricated 3 to 4 inches, and the patient needs to absorb it appropriately, hold it for 30 minutes. Also, we are going to be giving nasogastric tube meds today. Lots of patients, either they'll have feeding tubes or it'll be post-operatively. When we give a med through a nasogastric tube, number one, we want to check placement to make sure the tube is in the proper place. We do that with CO2 or pH. And then any policy that you look at, Eastern Maine, Maine Med, Maine General, each medication is given separately. So if you have more than one med, You check placement, you flush it with water, you give the medication liquid form preferred, or a pill that can be crushed and mixed with hot water, or warm water. And each med is given separately. So you would flush it, give one med, flush in between, give another med, flush again after. Then, if the patient was getting tube feeding or whatever, you would want to make sure that you clamp this tube for 30 minutes after the administration of the medication so that they can absorb it before reinitiating other therapy. So those are the rules. The other piece is you never want to give an enteric-coated tablet through this, crush or otherwise. You don't want to open up a capsule and put the contents of the capsule down the nasogastric tube because most of them are sustained release. And you also don't want to put a sublingual medication down this tube because it can be given sublingually under the tongue and bypasses the abdominal area. Okay, so what we're going to be doing in a few moments is we're going to be giving our patient a medication. And we will have all of our medications either on the computer, or you will have a medication sheet like this called a medication administration record that typically will have your PO and alternative meds and then your parenteral meds. So today, what we're going to be doing, Monique is going to be giving some PO medication. And we're going to be giving amoxicillin, metoclopramide, metoprolol, transdermal nitro, and Nasoport as an alternative. There's two alternative meds here, the transdermal medication and Nasoport. So what Monique is going to be doing here is she's going to be pouring these meds, and then we're going to be going to the bedside, and this will simulate how faculty will be supervising you when you're administering meds in the laboratory or in the clinical setting. Okay, Monique, go right over.
First, I would start by identifying my patient.
Sure.
And I would ask for his name and date of birth.
Sure. Francis Red, 3170.
And I'm going to compare his name band to my documentation that matches.
Okay, super.
Let me get my glove.
Medications are compared or checked 3 times. And Monique will demonstrate that. When she takes it out of the drawer, compares it, and then we'll compare it with the electronic record, and then again at the bedside.
So I have Francis Red, 3170. Allergies to aspirin.
Yes.
And so today we are first going to do the PO and alternative medications.
Yeah.
So he has amoxicillin.
What would we be using that for this patient?
So Mr. Red has a pneumonia, and this is an antibiotic.
Very good, thank you.
So I have Francis Red, 3170.
And what is your dose?
And I'm going to be administering 500 milligrams.
And I see you did your math. Desired 500 over half 200 times 5 mLs the vehicle, 12.5 mLs, correct?
In my med cup, and there's 12.5 mLs.
Okay.
I'm going to just double check that this is correct.
Perfect. She's pouring the liquid at eye level, which is more accurate. When you take a cover off a medication, if it's more multiple use, you always open it with the top down. Okay, she's going to check it one more time after she's poured it.
Amoxicillin. 200 in 5 mLs, and I have 12.5.
For 500. Great. Perfect. Next medication.
Next is going to be metoclopramide.
What is that
So I
med
have-
for? Reglan.
So this is a antiemetic and a prokinetic for nausea and to help stimulate the intestine motility.
Sure, great. Okay, super.
And so I have metoclopramide. I have Francis Red 3170.
Great.
And I am going to be giving 10 milligrams.
Correct.
And I have 5 milligrams in 5 ml, so I'm going to give
10.
10 ml.
Super. Okay. 10 mLs.
5 milligrams in 5 mLs for
Thank you.
10 mLs.
Super.
I'm going to save these bottles.
Yeah.
And I have metoprolol.
Yes, the doctor has allowed him to have a pill with a little bit of water. Yes.
So before I administer this, I would need to assess his blood pressure and pulse.
And you just did, and what
And
was
I
it?
did. And the blood pressure was 118/72, and his heart rate was 98. So those are both within limits.
And what kind of classification of medication is this?
So this is a beta blocker.
Okay. And why would he be on that?
So he has coronary artery disease.
Very good, very good. Great.
So I'm going to just double check.
Mhm.
Check metoprolol, 25 milligrams. I have a 50 milligram tablet, so I would need to break this in half.
Cut it in
before
half to give it.
administering.
Absolutely. Great.
And I have a transdermal nitro patch.
And what is that for?
So this is also going to reduce his blood pressure and for his coronary artery disease.
Coronary vasodilator. Right. So what should you assess before you give that?
I need to make sure that I have assessed his blood pressure, which I have
Good.
checked.
Perfect.
And I'm also going to make sure that I date and initial the patch.
Okay. Super.
And 0.3.
Mhm.
0.3. And then I'm going to get his nasoport.
Nasal quart.
16.5 grams. 1 inhalation in just the one nostril.
Correct. Very good. And nasal quart, is a steroid for.
To help reduce
Mhm.
inflammation.
Good. Very good. All right. So we're going to go to the bedside with these meds. And his scanning mech, unfortunately, is on the other side, but it'll all work out. Here we go, Malik. Let's see if we can get it. There you go.
Scan patient.
Okay. And for safety purposes,
I'm going to ask him his name and date of birth.
Francis Red, and his date of birth is 3/1/70.
And I would compare that to my record.
Good.
3/1/17.
Great. What meds, he's asking what meds you have today for him.
So Francis, I have your amoxicillin here. Do you know what that is for?
My infection.
Okay, perfect. And I have some metoclopramide. Do you know what that medication is for?
No, I don't.
Okay, so that medication is going to help stimulate your intestines to help try to get things moving again and help with the nausea.
Okay.
I also have your metoprolol here. Do you know what that medication
I've
is
been taking
for?
it. I've been taking it at home for my heart, my angina.
Perfect. And I have a new nitro patch for you.
Yeah, I was having a little chest pain. It's much better with that.
Oh, good. I'm glad to hear that it's helping. And then I also have your nasoport.
Yeah, I've got that sinusitis all the time, and now it's really bad with this tube.
Oh, good. Does this seem to be helping?
Yes.
Oh, perfect. So I'm going to scan each of my medications.
It's on the side that will work. There you go. Great.
Okay, so first what I need to do is check placement of his NG2.
Sure.
It looks like this facility we have two methods.
Yes.
So I'm going to ensure that this is off to my patient before I take this off.
Great.
I'm going to insert the CO2, turn it off to the out,
Mm-hmm.
and give it some puffs. And I would want it to be purple, indicating that it was in the stomach.
Yes, correct. Thank you kindly.
Also like to do the aspirate.
You can if you want to, but at this hospital, we can just one is fine, but you can do whatever.
First I need to flush.
And how much would you flush before?
I'm gonna do 20.
20 to 30
mLs.
mLs. Correct. Very good. Room temperature? It's in, no worries.
Okay.
Yep. Okay, great. So Monique is doing some water flush, and now she's going to give her amoxicillin. And normally I try to help a little bit more than I am now.
More.
Mm-hmm.
Next is the metoclopramide.
Mm-hmm. Great. How long will this remain clamped?
For 30 minutes.
Super, superb.
And next, I have his metoprolol, which I would remember to split into half.
Correct.
And he is allowed to take this with a small sip of
Small
water.
sip of water.
Which I would
Mm-hmm.
make sure he was sitting up.
Okay. He's taken it.
Francis.
Thank you very much.
And I have his nitro patch.
Okay, here's 10.
Yep.
Where are patches, transdermal patches best absorbed?
So on the upper chest
Or
and
upper arms? Good, very good, very good.
And I would check and make sure no old one was in place.
Very good, very good.
And lastly, I have your nasoport. So I'm going to insert it into the opposite nostril of the tube, and
Sure.
when I depress this, take a breath in through your nose.
Okay.
Okay. 2, 3.
Great. Super. Helps already.
Great.
So you're going to come over and chart your meds.
Amoxicillin, metoclopramide, metoprolol, patch, and the nasal.
Good. Awesome. Thank you.